Welcome to Special Education with Ahmed Naqvi. Dear student, we shall continue practicing MCQs regarding special education and in particular autism spectrum disorders field. Let us start. First question is, which term describes the difficulty individuals with ASD may have in understanding the perspectives and emotions of others? Cognitive bias, theory of mind deficits, emotional intelligence, or over empathy? Correct answer is B, that is theory of mind deficits. And we know theory of mind deficits refer to challenges in recognizing and understanding others' thoughts, intentions, and emotions, which is common in autism spectrum disorders. Next, what does the term meltdown mean in context of autism spectrum disorder? Excessive talking, intense or overwhelming emotional reaction, a simple mood swing, or losing interest in a favorite activity. The answer is intense and overwhelming emotional reactions. A meltdown is a response to overwhelming sensory or emotional input where the individual may temporarily lose control, often seen in those with ASD. Next question is, which of the following is a common comorbid condition in individuals with autism spectrum disorder? Bipolar disorder, dyslexia, attention deficit hyperactivity disorder, that is ADHD, or Parkinson disease? The answer is attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder, in short of which is ADHD, is a common comorbid condition in individuals with ASD affecting attention, impulse control, and hyperactivity. Next is, which structured visual support is often used to help individuals with ASD understand daily routines? Text only instructions, verbal commands only, visual schedules or picture charts, or sensory boards? The answer is visual schedules or picture charts. Visual schedules and picture charts aid individuals with autism in understanding and following daily routines, helping to reduce anxiety. Which behavior may be challenging for individuals with ASD in group settings? Remaining silent, following a single instruction, understanding non-verbal cues, repeating information verbatim. Answer is understanding non-verbal cues. Individuals with autism often struggle with interpreting non-verbal cues such as body language and facial expressions, which can affect social interactions. Next is, what does hyperlexia refer to the context of ASD? Difficulty with reading comprehension, advanced reading ability without understanding the meaning, complete lack of reading skills, or strong preference for listening over reading? Answer is advanced reading ability without understanding the meaning. And hyperlexia is the ability to read at an unusually early stage, but often without comprehension, sometimes observed in children with ASD. Next MCQ is which of the following describes a common approach used to improve flexibility in individuals with ASD? Rigid routines, exposure to various experiences and choices, avoiding new situations, or reducing all changes in their environment. Answer is B. Exposure to varied experiences and choices. Gradual exposure to new experiences can help individuals with ASD become more adaptable and reduce dependence on rigid routines. What is the role of a functional behavior assessment? In short, it is called FBA for individuals with ASD. To teach academic skills, to identify the reasons behind challenging behavior, to improve physical coordination, or to enhance artistic skills. Answer is to identify the reasons behind challenging behaviors. An FBA helps identify triggers and purpose of behaviors in individuals with ASD, guiding strategies to manage and replace those behaviors. Next, which of the following best describes selective mutism often observed in individuals with ASD? Choosing specific people to speak with, refusing to talk in certain situations despite the ability to do so, making loud noises consistently, or speaking multiple languages. Correct answer is B, that is refusing to talk in certain situations despite the ability to do so. Selective mutism is when individuals choose not to speak in specific settings despite having the ability, often due to anxiety or discomfort. What is one benefit of sensory integration therapy for children with ASD? Enhancing social skills directly, improving sensory processing and reducing sensory related discomfort, eliminating repetitive behaviors entirely, or enhancing memory skills. Answer is B, that is improving sensory processing and reducing sensory related discomfort. Sensory integration therapy helps children with ASD manage sensory sensitivities, leading to improved focus and reduced anxiety in sensory rich environments. Which characteristics is typically part of the restrictive and repetitive behavior criteria for ASD diagnosis? Loss of fine motor skills, limited or narrow focus on special interests, quick adaptation to change, high need for social engagement. Correct answer is limited or narrow focus on specific interests. Restrictive and repetitive behavior in ASD includes a focused interest in specific topics, often pursued with intense concentration. Which medication is commonly used to help manage irritability in children with ASD? Risperidone, acetaminophen, propranolol, or aspirin. Correct answer is the first one, that is risperidone. Risperidone is an antipsychotic medication, sometimes described to manage irritability and aggression in children with ASD. Which form of therapy focuses on improving the individual's social communication skills by practicing real life scenarios? Social skills training, psychoanalysis therapy, dialectical behavioral therapy, or exposure therapy? Answer is a social skills training. Social skills training provides individuals with ASD opportunities to practice and improve social communications in realistic setting. Which form of therapy focuses on improving the individual's social communication skills by practicing real life scenarios? Social skills training, psychoanalysis therapy, dialectical behavior therapy, or exposure therapy? Answer is social skills training. Social skills training provides individuals with ASD opportunities to practice and improve social communication in realistic setting. Next MCQ is which early developmental delay is often a warning sign of ASD in toddlers? Delayed walking, late babbling and lack of gestures, excessive crying, or early speaking ability? Answer is B, that is late babbling and lack of gestures. Delayed babbling and absence of a gesture, such as pointing, or early indicators that may signal ASD in toddlers. Next is which of the following is true about females with ASD compared to males? They are always diagnosed earlier than males. They tend to exhibit fewer repetitive behaviors. They show identical symptoms to males. They have lower rates of social challenges. Answer is B, that is, they tend to exhibit fewer repetitive behaviors. Females with ASD often show fewer repetitive behaviors and may present different symptoms compared to males, which can lead to delayed diagnosis. Next MCQ is which of the following is widely used evidence-based approach for teaching children with autism spectrum disorder? Cognitive behavioral therapy, applied behavior analysis, psychodynamic therapy, or pharmacological therapy? The answer is applied behavior analysis. Applied behavior analysis focuses on positive reinforcement to encourage desirable behaviors and teach new skills, making it one of the most effective educational interventions for children with ASD. What is the primary focus of early intervention programs for children with ASD? Academic skills building, developing social communication and adaptive skills, preparing for competitive examination, and reducing physical disabilities. Answer is developing social communication and adaptive skills. Early intervention targets essential developmental areas like social communication and behavior skills to improve long-term outcomes. Which visual strategy is often used to help children with ASD understand daily routines? Flashcards, picture exchange communication system, abstract art posters, or verbal reminders only? The answer is picture exchange communication system, which is in short known as PECS. PECS uses pictures to help children with ASD communicate their needs and understand routines, particularly if they are nonverbal and have limited speech. Why are individualized education programs crucial for children with ASD? To ensure all students follow the same curriculum, to address each child's unique needs and learning styles, to reduce teacher workload, or to prepare children for university level education? Answer is to address each child's unique needs and learning styles. IEP are tailored to the strengths, challenges, and goals of each child with ASD, ensuring personalized support in their education. Next is what is the role of occupational therapy in educating children with ASD? Enhancing reading comprehension, developing motor sensory and daily living skills, providing pharmacological treatments, solely teaching social skill? Answer is B, that is developing motor, sensory and daily living skills. Occupational therapy helps children with ASD improve their ability to perform daily tasks by addressing sensory processing, fine motor skills, and self-care abilities. Which teaching strategy works best to children with ASD who struggle with transition? Sudden changes in activities, using visual timers and a warning before transitions, avoiding transitions entirely, replacing transitions with unrelated activities. Answer is using visual timers and warnings before transitions. Providing visuals or verbal cues helps children with ASD prepare for transition, reducing anxiety and meltdown. Best of luck. See you in the next video.